Hello and welcome. My name is Dr. Kamran Jafri. I'm a double board certified facial plastic surgeon in private practice here in the wonderful city of Manhattan. I want to thank you today for visiting with us. In the following video, you will follow two of my patients, Jose and Diane, as I go through the custom lift experience. As you know, plastic surgery is at a very exciting time right now. There are a wide variety of procedures available to you and many options to consider. It is my hope that you find the following video to be informative, educational, and insightful as you yourself consider going through this experience. Thank you very much and enjoy the video.
Shh! Quiet on the set. My name is Diane Masters. I'm in my 50s. I reserve the right to lie about my age, but yeah, up there. I am a writer and I am a life coach and also a producer. I am here today because I don't like my jawline. It needs to be back up there. And Dr. Jafri does a wonderful procedure that just works on the jawline. Looked in the mirror and said, where did this go? And how did this get like this? So you go to sleep and you have a jawline, you wake up in the morning, you don't. And I live in New York City, and looking older and being out in the workforce and being around all the 25 and 30-year-olds, we have to compete anyway, so you have to look your best.
My name is Joe, 71 years old. I'm not working anymore, I'm retired. I was a businessman, I own my own business. I do a lot of things. I bike, I exercise, I walk. I'm an exercise machine. As long as I live, I like to look better. I like to hang out with the younger people and I like to look like them. I don't want to look old. I don't mind to be old, but I don't want to look old. Every day I look on the mirror. I saw this thing hanging down on me. You know, it didn't look right. I was looking for ways to make it look better.
Well, I was introduced to Dr. Jafri about 5 years ago, and he really is the kind of doctor who you don't see too much anymore. It's like the old country doctors there, and you can sit down, you can talk to them, and they call you. You don't see that kind of work anymore.
Ever since I was a kid, I've always loved working with my hands, and that tied in with a real love for biology. My father was also a physician, so I think I got exposed to the medical field very early on, and as time went on, that just kind of seemed like a natural blending of things I had passions for. I decided that medical school was the right way to go. I had the very fortunate opportunity to work with some of the leaders in the field and learned a lot of things from them. But I think also more importantly for me was to get away from being part of a big corporate practice. I was getting away from what a doctor is supposed to be, and a doctor really should be one-on-one with their patients. You need to get to know them, they need to get to know you, and you really need to spend time with them before you decide on any procedure to know what their goals are so you can make the best decisions for them. The custom lift procedure was something I developed over many years. A lot of the emphasis on facelift procedures were the really invasive procedures. However, as time has shown, a lot of those more invasive procedures come with a lot of problems. The complication rate can be higher, they require general anesthesia, the cost can be prohibitive as well too. A lot of those procedures can be anywhere from $15,000 up to $50,000 depending on where you have it done. When you pull on muscles too much and you try and get them up too high, you get a very unnatural look. And that's a result of older ways of doing it. During the end of my training, what became in vogue was the more milder procedures, what we call the mini lift procedure. But unfortunately, while they do offer quick recovery, they offer fewer complications, the results aren't as long lasting. If you're going to go undergo a surgery, you really should get more bang for your buck. There's really a middle ground that should exist. You know, you should be able to get a procedure done safely and effectively under local anesthesia, but you should also get the benefits of the deeper, longer lasting procedure. Custom lift by its name kind of describes what we're doing with it. Every procedure is unique, and I use a lot of the techniques that we use in the deeper surgeries for patients to get the kind of results we're looking for, but without the recovery time that you get with the longer procedures.
I love local anesthesia. Healing time is faster, there's less bruising, you're not groggy, you come up, you're out the door. When you see mishaps in the hospitals on any surgery, it's always in the anesthesia part. So here you are under local, nothing's going to happen. It's a healing time for me. I'm going to do this procedure today. I have someplace to go on Wednesday.
I think maybe it's easier. It's easier and shorter. And nervous, maybe a little bit nervous, I'm not sure. I'm not even sure if I'm nervous, but I think I'm okay. I hope I achieve what I wanted to achieve. I want to live happy. And that makes me happy.
Yeah, I think when patients come here, and they're always surprised at what a unique setting this is. We want it to be when patients come here, we know them. We know them by name, we know who they are, we respect their privacy, and each time they come in, they know they're going to get the same excellent care each time. I think other things patients are surprised by is they get my cell phone number. Once you're a patient of mine, you get direct access to me. When you come in for your consultation, it's not a sales pitch. I don't use consultants here, I don't use medical assistants. When you come in to talk about your procedures, you meet with me directly. And I think that only makes sense. I'm a doctor, I'm a surgeon, I'm the one that does the procedures, I know what works and what doesn't work, and I don't want anybody in between me and the patient confusing that picture. I think one of the things that's unique about my practice is the Cosmetic Karma Foundation. With that, what we do is every patient that comes in, whether they're getting a simple little mole removal or a more bigger procedure like a reconstructive type procedure, we take a portion of their fees and put it towards a fund. And we're at the point now where we've opened a school in India to help out unfortunate kids there that are either orphaned or can't afford to go to school. We're going to be working with some of the veterans from the Iraq War and Afghanistan War, American veterans, to help fix some of their scars. And it's all free for them. And it comes through the surgery. So I tell patients literally if somebody's getting a facelift, they're actually helping somebody get shelter that's been through a cyclone. And it sounds, a little bit, idealistic, but it's working because we're all working together to do some good things.
I feel great. Very happy with the results, very happy. The wrinkles not here no more, and Dr. Jeff's still saying it's going to even get even better.
It went well. It was great. I absolutely am pleased with the results, and I'm very pleased. And everybody else that sees me thinks he did a great job. He already had started cutting, and I didn't even know he had. I asked him when he was going to start. And that was Monday afternoon. Wednesday evening around 6:30, I had my Italian group always comes to the house once a month. And I was a little swollen, but it wasn't something that people really noticed until I said, I had work done. By Thursday, I could go out. And there was very little pain. I took Tylenol. I didn't even take pain medicine. It was good.
The recovery process was very easy. It took about a week and a half. I'm glad I did it. I'm glad I found Dr. Jafri. I think he did a good job. And I recommend it to anyone and to anybody.
This is the best result I've had, absolutely the best result I've had. My face was much tighter, and yet not people we don't want to, who will remain nameless tight. But I feel great, I do. I see the difference in the mirror, and it's really more what I think than anybody else thinks. I want to be able to look in the mirror and feel comfortable with myself.
I didn't want to publicize it, I just want to look better and have people look at me and notice it themselves, not me telling them what happened. And people, they say, oh, you look great, but I still don't tell them what happened.
I have always recommended Dr. Jafri to all of my friends because I've known him a long time, and I knew that he was a caring, very special doctor. But I always say, make an appointment and see him. I've never, ever had anybody come back and say he wasn't everything I said he was.
I think it's very rewarding when I see my patients back for their follow-up visits because I get to see my work, and I get to see how they're doing with it. And it makes me happiest when they say to me, hey doc, you know what, people are looking at me and they don't know I had surgery, but they know something's a little different, and they're asking me questions like, were you on vacation, did you lose weight? And I know that's successful then. It means a lot to me. The thank yous you get when patients say a thank you because they're feeling energized again, because they feel like their inside matches their outside, is a really rewarding thing. And it's kind of like we're taking a journey together. And it's so nice to go from point A when I first meet them to point B when we finally get done, and we can both sit back and be very happy about what we're seeing and really say, you know what, we got done what we're looking to do, and it's a really great day for both of us. So that makes it worthwhile. I leave the office those days, and it's a good day.